To continue on the second page, we're going to look at the how would it work section. As I had talked about earlier when we talked about the claim of policy, and this was her solution section, that's really the biggest use of this here, is that it really is that solution and she's answering their questions. So you probably won't need to be talking about this with any of the ethos, logos, pathos section. Okay, moving on down to equitable access. Now, here we start getting into Friedman's concession and her rebuttal. So we actually have one of each in this article. This first paragraph has a concession. If you remember looking at the information about concessions and rebuttals, the concession is that you concede a point to your opponent, but then you follow it up with a however. Remember that you follow it up with something where you show that you have a stronger point. You're not poking a hole necessarily completely in what your opponent is saying. You don't completely disagree with them. You say, yes, something that they say does make sense. Then you go forward and say, however, you show how then your side would be stronger. So when we look at this, Friedman starts with opponents of payments to living organ donors focus on several issues. The immediate past president of the United States. Okay, so first we have opponents of payments. So we know she is going to be addressing her opponents, right? She knows that there are going to be opponents to it, and she is addressing this part in this part of the argument. So then the immediate past president of the United Network for Organ Sharing, Francis Delmonico, suggests that the kidney shortage is driven by societal failure to prevent preventable renal disease. I agree. Okay, so what she's saying is one of the people who is against the payment for living organ donation is Francis Delmonico. She tells you who he is. He's past president of the United Network for Organ Sharing. But what he's saying is that this kidney shortage, he's addressing a specific organ shortage. He's saying the kidney shortage is driven by our failure, society's failure, to prevent certain preventable renal diseases. And she's saying that she agrees, right? She says, I agree that we need to improve the quality of care to all members of society. Because basically what she's getting at is that Delmonico wants to focus on preventing the renal disease, right? That is where the focus needs to be. That's where the resources need to be allocated, not to purchasing live organ donors, donations from live donors. So what she's saying is, even though she agrees, she said, I agree, we need to improve the quality of care. We need to prevent these diseases as much as we possibly can. So she's conceding that point to him. But then she says, however, it seems unfair to penalize people who have already developed disease as a consequence of the flawed care they were powerless to improve, or to ask patients to wait for ideal medical care that seems unattainable. This is particularly true for people who are economically or ethnically disadvantaged. Okay, now there's a couple things going on in there. One, you'll find that the ethically disadvantaged, you'll find quite often throughout Friedman's argument that she brings up this inequality when it comes to socioeconomic class, right? How people are not treated equitably, how people who don't have a lot of money don't always get the best treatment, et cetera, et cetera. So, because she knows that her audience is going to care about that. Her audience wants that equitable treatment, and she keeps bringing up how it's not equitable, especially between these socioeconomic classes. So, as she's going through here, and she says, however, it seems unfair to penalize people, et cetera, et cetera. So she's saying, okay, yes, we should prevent them, and we do need to focus our resources on that. However, it's not fair to not treat the people who already have renal disease. It's not fair to not put resources toward getting these organs from the live donors. She said, because the people who are going to be affected, the people who already have the renal disease, it's not their fault necessarily that they have that renal disease. And especially if they were powerless to change their medical treatment, that they couldn't get the medical care they needed. And so then she goes on to say, if this approach was reasonable, people with sexually transmitted diseases and women carrying unwanted pregnancies ought to be denied the benefits of care because they have not taken appropriate precautions. Now, what she's doing is just like when she talked about comparing the donations that are legal, like the legal use of the body that's paid for, and she compared that to what she wants to be legal, which is the payment for living organ donation. She's doing the same thing here, but sort of in reverse. She's comparing something that she wants her audience to disagree with, which is that we should only put the money, and the resources toward prevention instead of treatment, and talking about the organs and the renal disease. And so she doesn't want them to agree with Delmonico. So she's comparing what he wants to something that she knows they would disagree with, that they will find outrageous and definitely disagree with. So she's going to take something that she knows they'll disagree with, compare it to what she wants them to disagree with to get them to disagree with Delmonico. So she knows that they're going to disagree with this, where she says people with sexually transmitted diseases and women carrying unwanted pregnancies ought to be denied the benefits of care because they have not taken appropriate precautions. She finishes it with, there is little dignity in dying without access to medical treatment that is known to have a high likelihood of prolonging life. So she's really pulling out that pathos, right? She's really playing on them wanting to take care of everyone, wanting the equitable treatment. And so that is how she is discrediting what Delmonico wants by comparing it to something she knows they're going to already disagree with. Now, the next section here is going to be her rebuttal. So here we had a concession, which is the I agree, however. Now we're going to have a rebuttal. The rebuttal, a compelling argument that money in exchange for an organ would exploit the most needy, was countered by Anthony Monaco. Okay, so what she's doing here, she's saying a compelling argument that money in exchange for an organ would exploit the most needy. She knows that this is something else that her opponents are going to say. And she says, okay, she's going to address this too, but she's not addressing it directly, not herself. What she's doing is she's using another expert, Anthony Monaco, not to get confused with Delmonico, Anthony Monaco, who is a past president of the American Society of Transplant Surgeons. So she's using this expert, right? She's giving us his credentials, which are quite good. She's even giving us the source here to show us that he is the past president of the American Society of Transplant Surgeons. So she's saying, here's this expert in the field, and this is what he has to say. This is how Anthony Monaco is going to counter the opponent. So then she says, Monaco noted that developed societies have already become comfortable with the use of tangible recognition for personal self-sacrifice that is most likely to flow to the needy. So she's saying, look, we already do this. Just like before when she says, look, we already pay for the use of the human body. Why can't we do it now for this? She's saying, look, basically that this already takes place. Of course, there are times when some sort of personal self-sacrifice is going to most likely be aimed at or at least be most used by the needy, right? The financially needy. And then it's compared to, well, she's not saying this, Monaco's saying this, Anthony Monaco. And he's saying, if military service can be recognized with inducements such as paid education, enlistment bonuses, and financial recovery for injury or mortality, got to skip down here, why should the decision to donate an organ be viewed differently? So she's making, well, through Monaco, she's making a comparison between paying for live organ donation and military service, saying, look, this is something else where people have there's risk and some self-sacrifice, and yet, not only are they paid for it, they're given extra bonuses, etc. So through Monaco, she's trying to say that this already takes place. Now, personally, I think this is sort of a weak comparison because it is a job and not just a service. But there are other things she could have also compared it to, which she has other comparisons of the most needy using it in that column before where she's using the logos, because she does say that, as far as surrogacy, people selling eggs and sperm and blood and hair, the most needy are the people doing that as well. So we're already, I'm not sure why she didn't just refer back to this for her argument, but she decided to add this in. But it is it is a fair comparison, and that is how she's doing her rebuttal through Anthony Monaco, who is another expert.